Okay, I'm gonna try to do this fast while she's asleep. Everything that happened to me postpartum, apparently the hormone that's released makes you forget the pain of childbirth so that you'll do it again. I currently can still recall it. I can still recall the pain from childbirth. Well, I don't know, I got an epidural. The first thing that I wrote is that you have zero dignity left. Obviously for midwives and doctors, OBs, gynecologists, this is like the everyday for them. So it's not weird, it's not out of the ordinary. They see it constantly. So don't feel self-conscious. I know it's easier said than done. Don't feel self-conscious about when you have to push. I felt self-conscious when I was pushing that I was going to shit myself on the table. That's also very common and apparently is a sign that you're in the right direction and you're pushing in the right place. There's going to be weird smells going on. They've seen it all before. They do not care. Someone texted me and asked me if I shaved. When I was pregnant, I could barely see my vagina, let alone shave it. So no, I didn't. Because I got an epidural, you have to get a catheter in. And if you don't know what a catheter is, it's a tube that goes up your pee hole and you piss in a bag because you have no control of your bladder. You can't feel anything down there, but your bladder has to be empty to let the baby come out. Otherwise, it can like rupture your bladder or something bad. And from that, UTIs and bladder infections are really common. So to make sure that you're drinking loads and loads and loads of water, try to avoid caffeine as hard. I know that's stupid, the stupid thing to say to a new mother because you need all the caffeine that you can get with the lack of sleep. I'm having like 1 cup of coffee a day, but to be honest, like if I have another second cup, I will have an anxiety attack anyway. But you shouldn't really be having a lot of caffeine or like really sugary drinks or letting yourself get dehydrated, because if you do get a UTI or a bladder infection, that's really bad and I'm pretty sure you have to be readmitted into hospital. You need to be drinking lots of water anyway if you're breastfeeding too, because you can get dehydrated really fast. Invest in a good water bottle. I got a hydro flask. I got a big liter bottle hydro flask. I wish I did get the straw cap so it's like less dangerous, so I don't have to go like this, if you know what I mean, because if you're breastfeeding and drinking at the same time, I am a bit scared of dropping the bottle on her head, and it is very heavy and it keeps it nice and cold. Like at night time I put ice cubes in it and it's still like freezing in the morning when I wake up. So to make sure that you're always drinking, I have about 3 or 4 of these a day. What I usually do to avoid UTIs and bladder infections as well is to try actually air out your vagina, because obviously if you constantly have pads, period underwear, sanitary towels, toilet paper, all of that, and it's always like concealed, covered in something, it's very easy for particles or bacteria to get in your pee hole. So do try to air out your vagina. Put a dark towel down and maybe for like an hour a day and let yourself free bleed lying horizontal like on the couch or in your bed, and that way you can do the lying down breastfeeding position as well, so it's not like affecting you or your baby. Now I'm 3.5 weeks postpartum, nearly 4 weeks postpartum. I can go a whole night with just tracksuit bottoms and no underwear on when I'm going to bed, and I might get a bit of spotting, but it's fine. I just rinse it in cold water and then throw it into the washing machine so it doesn't stain. Because you have no control of your pelvic floor, you also can't clench your bum. If you need to fart and you're in company, usually people like clench their bum and make sure that it doesn't let loose or let rip. You cannot feel when a fart's coming, so you will just fart freely all the time. Like I had people coming and visiting the baby and it would literally just be like, you know. Luckily it was just my close friends and family, but there was a lot of times where Jason's family was over or I was visiting Jason's family and I thought that I was going to be farting the whole time. You'll lose a lot of blood. So if you think about how much blood you lose on your period and you're feeling a bit run down, low energy, maybe your under eye bags are a bit more purple than usual, so you're told to take an iron supplement. I think a lot of girls, very common to be anemic, to make sure that you continue taking your pregnancy supplements while you are losing that amount of blood, because they are really high in iron and like the good nutrients that you do need while you're losing a lot of blood. Still, you still need to look after your body. You're going to be very run down, but it's like your period but prolonged. It's usually 4 to 6 weeks, and if you're bleeding any longer than that, you should go back to your midwife or your GP. Your hormones can pass through your baby once they're born. So if you think of like the teenage hormones that women have, obviously as a grown woman your hormones will be different than a newborn baby. In that case, they can get acne, they can get face acne, they can get a mini period, and they get discharge. Now, I can't remember the actual official names of them. The discharge is called something. I remember my public nurse telling me, but I can't fucking remember. So that is very normal. She did get a mini period. It was just like a spotting of blood and a nappy that we saw one day. Well, Jason actually saw, and he was just like, is this normal? And I was like, yeah, it's normal. She also got some acne on her cheeks, but then it does go after a few days. So with the epidural, it took way longer than I thought to actually put in. Like while I was getting the epidural put in, I probably had about 4 or 5 contractions, because when I've watched birthing vlogs or I watched the Rotunda documentary, obviously the epidural, it doesn't show the actual amount of time that it takes to put in and how long it takes to actually kick in as well. It takes around 20 minutes to kick in fully, but after about 10 minutes I was feeling the effects. It was almost as soon as it was put into me, I was feeling a lot more relaxed, just because I kind of knew that I was going to get some pain relief soon. When you have a contraction, you have to wait for it to finish before they can keep going, so it does take a long time to get the epidural in. One of the negative parts of having an epidural, and why I didn't want to have one, is because you have to give birth lying down, and obviously you're going against gravity then with your baby, so it's harder for them to go further down into the pelvic floor, which what happened to me, so I had to get an episiotomy, and an episiotomy is the same as a second degree tear and results in stitches, and just makes the healing process a lot more complicated. If people are wondering if I would get the epidural again, knowing that I might have to get an episiotomy again, I probably would, because the pain was too much. I think it was worth it in the end, even though my stitches did get infected and stuff too. I would try next time, my next birth, to not get any pain relief, but obviously you have to see on the day if I'm having a home birth or not. Like, I don't know how it's going to go with my next baby, so if I was in the same amount of pain that I was in that birth, I would get the epidural again. Bounce on an exercise ball while I'm getting contractions. I didn't have a yoga ball or an exercise ball, but I know that's very good for getting the head down further into the pelvis. But she didn't even have a cone head, and most baby, if they are lodged in the pelvis, that's a good sign if they come out with the cone head, because they were there for a long time, where she was up way too far and she was in distress, so they had to get her out fast. So you stay in the labour suite for about 2 hours after you actually give birth, but if you needed a baby doctor or if you need stitches, there's usually loads of people still in there, so it wasn't that like relaxing quality time that I was expecting to have with my family. The doctor sewing me up, and she needed to get her lungs sucked out because she was born in her meconium, but Jason was like looking after her, obviously with her by the bed, so I didn't get a lot of time with her. But then once she was finished, then she was feeding on my boobie, and Jason was able to leave to get me a meal. He got me some sushi and came back. We ate that for a bit together, but I wasn't even able to finish the food because by the time he came back, I needed to go to the labour ward. While you're in the birthing suite as well, the midwife gives you like a cloth bath, so they just wipe down any blood or like goo that you have on you from birth. So you do get a wipe down before you get put into your wheelchair to go to the labour ward. She gets put in a wheelie crib, and Jason pushed her while the midwife pushed me into the labour ward in the wheelchair, because you're still paralysed, a little bit paralysed. Well, you have like you're not fully paralysed, you just have gammy legs for about 6 hours after, so you have to be careful with like walking around and like balancing on your own 2 feet. And then once I got to the labour ward, it was past visiting hours because it was night time. She was born at 20 to 8 and the visiting hours end at 8 p.m. If he's allowed to stay the night, I would get a private room. I would opt for a private room in the maternity hospital. I actually took some videos while I was in the labour ward and what it looked like, so I'll insert some here. It's just about the length of a bed, and then the width of a double bed is the little cubicle you have. I was lucky that I had a window next to my bed, otherwise it would have been I think it would have been really depressing. It was something like American Horror Story. I really didn't like it, and I wanted to leave early, but I couldn't because she needed to see the baby doctor 24 hours after giving birth to make sure that she was okay. Your baby gets a hearing test, the baby doctor checks that for hip dysplasia and random stuff like that. You get offered if you want a bath or not. I know it's good to not bathe them for a good 10 days after giving birth if they were born in vernix, because vernix is really good for their skin, but she was born in her meconium and was covered in blood, so I did get her a bath. Also, if your baby's over a bit, she was 5 days over, their hands and feet tend to peel, so a lot of her skin was peeling off once her umbilical cord fell off, which it came off in 5 days, but it's different for every baby. Once their umbilical cord falls off, you can submerge them in water then, and then we were bathing her here rather than a cotton wool bath, which is what they gave her in the hospital. We were putting her in her bath seat, and then afterwards we would give her an oil massage with a very simple oil to get all the dead skin off, and then also keep the new skin moisturized, because it's a new environment for the baby and they've just been in water for 9 months. I forgot to say, for the epidural, I didn't feel any pain at all. I did not feel her coming out, I did not feel getting cut open, I did not feel the stitches. For the contractions, you feel pressure, I knew there was one there, and I think that's why it was so hard for me to push, because I literally could not feel anything, which was good in a way because I didn't feel any pain, but I would have preferred to feel a bit of pain to be able to push her out a bit better, but because I felt absolutely useless, I was I'm not doing my job as a mother. I knew it was going to be a really scary experience for her coming into the world, so I was oh, I feel bad because I got some pain relief and she didn't, and she ended up having to get yanked out with forceps on her cheekbones. Oh yeah, if you do get an episiotomy and a forceps delivery, the babies do have a bit of bruising on their face, which should go in the next day. Oh, I'll just put her on my boob and then come back. Oh my god, did you hear that? That's her, by the way, not me. If you do get an epidural, you don't feel pain for 24 hours, but you do feel a lot of pressure. I was kind of curled over walking to the bathroom. The only way I can describe it is it kind of feels like all your organs are about to fall out at any point. So I was kind of like, I didn't want to stand up straight while I was walking. It's a really horrible feeling. Then I got a bit of overgranulation next to my open wound, so it was really, really sore for me to walk for like a week or so. So that was like, I had to be lying down and on loads of painkillers, otherwise I would literally be crying in pain. And my contractions post-birth as well while I was breastfeeding were really bad. Like it was like I was in labor again, like screaming, crying in pain, but they didn't last that long. Like it was about a half an hour of pain, which was fine. All babies are kind of born with a little bit of jaundice because obviously they're ingesting their wee or something in the amniotic fluid. I'm not actually sure why they have jaundice, so you just have to make sure that you're feeding them really, really often and that they're pissing and shitting it out. So to keep track of how many wet and dirty nappies that the baby has, because the midwife will be coming around and asking you, like I wasn't keeping track at all, and they were like, how many wet and dirty nappies has she had? And I'd be like, I don't know, I can't remember. And they'd be like, when's the last time you fed her? And I'd be like, I don't know, I literally don't even know what time it is. So to make sure you or your partner is like keeping track of how many times they're getting fed, how many wet nappies and how many dirty nappies they're having. Now it's like we don't really keep track now because she literally feeds constantly and always has a dirty and wet nappy, to the point where we know that it's normal, so we know that we don't need to keep track of it. If she's like not feeding as much, or we feel like there's not as many dirty or wet nappies, then we would start. But I did hear that sometimes breastfed babies have less dirty nappies because there's less for them to actually shit out. Like they absorb most of the breast milk that goes into them because it's mostly water, so they have a lot more wet nappies and absorb the rest of the nutrients and like pack on the pounds basically. On this newborn's second night of their life, they like to cluster feed for the whole night. So to do the lying down breastfeeding position and swap boob, it's usually every like 10 minutes or so, which does seem so exhausting. But then the next day they don't really feed that often and you can both sleep really well. Like the baby's been up all night too, so you could both nap during the day. I understand it as well because healthcare professionals are really underpaid in Ireland, so a lot of them are emigrating and everywhere is really understaffed. You're not going to get as much help as like they did back in the day. Like my auntie was telling me that you'd stay for like 5 days and midwives would come up to you at night time and be like, do you want us to take your baby so you can sleep for the night? Like you wouldn't be getting that in any maternity hospital. There was definitely less help than I thought there would be. Women in my life that have had kids before, they were like, stay in the hospital as long as you can for the help, but I literally wanted to go home as soon as I was in there, and there wasn't that much help. So for healing with if you do have stitches or just in general, I can obviously only speak from the experience of someone who had stitches and they got infected on what I did wrong and what I would do differently now the next time. I initially bought the Freedom Mom cooling pads, the witch hazel foam, and I had the My Expert Midwife perennium spray thing, spritz for bits. And I also had the soak for bits, but I didn't use that because someone told me that baths are bad, so I didn't take any baths. The doctor told me is to make sure that you're using pads that are plastic free, because the ones that have the plastic lining basically keep in the sweat and then you have a higher risk of getting an infection. She also said that using those witch hazel foam healing sprays and all that stuff can actually dissolve your stitches faster than you're healing. I think that's what gave me an infection. Going to the bathroom, what I found is the best thing for me was if I did a poo, I would use a baby wipe on my bum, and then I would use the peri bottle to spray my bum and my vagina just to make sure there's no bacteria anywhere there, and then to use a reusable cotton pad to pat dry, or like a face cloth towel, and to make sure that you have a mini laundry basket in your bathroom to wash all of those, and you can wash them separately from your clothes if you wish to keep them separate. I have a basin also in my bathroom for blood-stained things to be soaked and then to be put into the washing machine, and I use the Nature Care bleach-free, organic cotton, chlorine-free, plastic-free maternity pads, and they were the best and the comfiest for me. The Freedom Mom cooling pads you cannot use on open wounds. It literally says it on the packet, and you can only do cooling therapy for 20 minutes at a time. And when you're basically paralyzed and find it really hard to go to the bathroom, it's difficult to go and do all that rigmarole changing those fucking things. To be honest, I think they're a waste of money. Take pain relief rather than putting stuff down there. It would be my advice. And then when my blood lessened a bit, I just wear period underwear, or I would wear normal underwear with a reusable sanitary towel, because I'm not going to be using tampons for a while, because I really want to take care of my yoni now after it's been through all of that trauma. So I won't be putting up anything in there for a while. I am a tampon girl, so I just invested in loads of sanitary towel, reusable sanitary pads, and a period underwear as well. So that's what I do recommend using to make sure that you have enough to keep you going for the whole day, and then have a basin in the bathroom full of cold water to soak out the blood and then to throw it all into the washing machine together. I didn't use any toilet paper at all, just by the way. Toilet paper, I don't even think I'll use toilet paper ever again. It feels way cleaner to just use reusable cotton pads to like pat dry and to use a peri bottle. I don't want to be putting that near me. To take stool softeners if you are scared to take a poo. My first poo wasn't that bad, so yeah, don't be too scared to do it. You just have to like make sure you're breathing and that you're relaxed while you're doing it, and not to push yourself too hard either. Then with pissing yourself, every time I'm about to go into the shower or if I hear running water, I do pee myself, because you don't really have control of, again, your pelvic floor is like the muscle that helps you hold in your pee. You shouldn't be doing that anyway because it's bad for your bladder, I'm pretty sure, to do that. But if you want to check if your pelvic floor is there, just test it out on the toilet while you're peeing to see if it's there, but don't be doing it all the time. I did piss myself just as I was about to get into the went down the wrong way. Yeah. You are at risk of pissing yourself. So the reason I was pissing myself in the shower, I think, as well, is I do pee in the shower. So I was like, oh, I feel like I need to pee, but I'll just wait to get my clothes off before I get into the shower. Like, this is the amount of time that it took for me to piss myself. I registered that I needed to pee. I wasn't like bursting or anything. I was just like, I know I need to pee, so I'll just wait until I'm in the shower. I'll take my clothes off. Turned the shower off, took my clothes off, and I didn't even know that I was peeing. I just felt it come down my leg. So then I just had to jump in the shower quickly, so it wasn't a huge disaster. It's not like I was wearing my clothes. So to make sure you're going to pee regularly, because you are at risk of peeing yourself. Sorry, okay, I need to change your nappy and then I'll come back. Oh. Okay. Hygiene for down there is that when you're in the shower, make sure that you're spreading those flaps, girls. Obviously don't have the power shower on, and have it a bit cooler than you had it when you were in the shower. Like, don't have it too hot, because I think that can cause your stitches to dissolve a bit faster, and you don't want to get burnt down there either. So to make sure that it's not on too powerful of a setting, and to make sure that it's a bit cooler than you usually shower your body in. No one actually asked me this question, but maybe people are too scared to ask me, but this is something I was curious about when I was pregnant. It's if you still have a sex drive after you give birth. Now apparently the hormones that are released while you breastfeed, and obviously with like you being cut open and stuff, everyone was like, oh, you won't have a sex drive at all. No, I do still have a sex drive. Me and Jason were making out the other day, and because there was like a bit of, flutters down there. Ow! Oh my god, she pulled my hair. Are you still hungry or what? Oh, I need to get those hairs out of her hand. Are you okay? Are you still shitting? So apparently the hormones from breastfeeding, and obviously from like the trauma of giving birth, you wouldn't usually have a sex drive, but I still did. And when we were making out, there was like, I got fanny flutters and my vagina really, really hurt after. So I don't know what exactly went on down there. So we're just like making sure not to go through that again. They say that you should wait to 6 weeks to have sex, because even if you, oh yeah, she has her mouth open. No. They say that you should wait 6 weeks to have sex because your cervix is still open and your womb is basically still an open wound, so you can get a uterine infection, and that apparently is really dangerous and something you do want to avoid. To absolutely in no way in hell have sex until you're 6 weeks, even 6 weeks postpartum. Even if you have stopped bleeding, safer to just wait the 6 weeks. Now it could be longer for me because I do have stitches. They're not infected anymore. I had a doctor's finger up my vagina to check the other day. I don't know how long they'll actually take to fully heal. I think it can take up to 2 months. So I'm just gonna wait, and apparently it's really sore to have sex after an episiotomy as well. But we're just gonna wait as long as possible. It's squirting, quick, open. Now for a bit on breastfeeding. I could probably do a more extensive video once I've done it for a bit longer. I've only been breastfeeding obviously since she came out, and she's like 3.5 weeks. But the tips that I do have for breastfeeding is that if you are sore, to do the lying down breastfeeding position. That was the best thing for me. Get your partner then to lift the baby up to burp them. If you are sore, it's hard to lift your baby and to sit up in general, so if you have help. Another thing as well, don't be afraid to ask for help, especially if your partner's gone back to work, the paternity leave is over. You're not a failure of a mother if you need to ask for help. I thought that everyone would be like, oh, you shouldn't have had a baby if you need to ask me for help. No, everyone, no matter, even if I was a fucking super mom, everyone still needs a bit of help. So take as much as that you can get. Yeah, for breast pads, I do have reusable breast pads just so there's a little bit less waste. Now I got them size medium. I probably would go for a size large, and I'm probably going to order more anyway because you run out fast. The only thing is with the reusable ones is you can feel when they're wet, whereas with the disposable ones it kind of just absorbs everything. So you do probably have to change them more often, but it's probably more hygienic, I think, to do that. I'd say so. And obviously it's more sustainable to use reusable breast pads. Another thing is you can see them. You can see them if you're wearing just a bralette and not like a bra. You can see them through your t-shirt, like the ring of the breast pad. Or if you're wearing no bra, which it's probably hard, you do need support while you're breastfeeding, because your back does get very sore from the weight of them. I do have breastfeeding bras. This one has like a clip down thing. I got this from my stepmom's sister, gave me her old ones, but I have ordered more as well because I underestimated how big my boobs would get. Like even the maternity bras that I was wearing while I was pregnant are really, really tight on me. To make sure that you're as comfortable as possible, get a boppy, but even if a boppy doesn't work for you, just to make sure, like setting up pillows in a certain way can help, especially with your elbows. And just breastfeed for you and your baby and no one else. If you don't feel comfortable and you don't like it, you don't need to do it. And also to breastfeed wherever you want. Like I breastfed her walking up Georgia Street once because she wouldn't stop screaming, so I just took her out and was like walking and breastfeeding her at the same time, which is probably a safety hazard, but like I needed to do what I needed to do. I'm doing it for all the women who needed to breastfeed in the McDonald's bathrooms because they were too uncomfortable to do it in public. Dad's home! Dad's home!
How's she been?
So good.
Really?
She literally slept for like 3 hours, so I got to do my makeup without holding her. I got to brush my teeth, and she slept like just there on the bed. I got to eat lunch. I got to do a YouTube video.
Just on my lunch.
And,
You're back to normal.
I'm back to normal. I do smell so bad though. I keep thinking it's her, the sour milk smell, but it's actually me.
Oh yeah.
But I'm gonna give her a bath. She just did a huge shite.
You changed it?
Yeah, of course I did. And I'm gonna give her a bath.
Okay, I'll send her lunch and I'll hold her for a bit.
Okay, love. Oh, you have another package on the couch as well.
Me?